Now let's see the preparative assessment of a patient undergoing cardiac surgery. So this is the history and physical examination of the patient, laboratory studies, and imaging studies. So history is going to be past medical history, past historical history, allergies, medications or drug the patient is taking, and social. So past medical history, we need to evaluate neuro. This is if the patient has had a stroke or a transient ischemic attack. This is because morbidity and mortality is going to increase in a patient with this history, stroke or TIA, after a cardiac surgery, and also because one of the most important complications in cardiac surgery is the ischemia to the brain. So if we have a patient with a neurological, with an abnormal neurological examination after cardiac surgery, we need to know if that is a new finding or if it's an old finding. So we need to know the neurological history of the patient. So stroke, transient ischemic attack, or carotid stenosis. Then cardiovascular. So if the patient has angina, or if the patient had a coronary artery bypass grafting done, or a stent placement for a myocardial infarction, or if the patient had a valve replacement. We need to know the complete cardiovascular history if the patient has angina. So this also is going to include the medications, but we are going to prepare different to this patient to another patient. If the patient had a valve replacement, we will also ask when was the valve replacement and if it was a biological valve or if it was a mechanical valve, and if the patient is currently in anticoagulation or not. We also evaluate for peripheral veins. So if the patient has vein resection or distal vein reconstruction, this is because this can alter the cannulation we use for veins. Then we ask about pulmonary history. So if the patient has COPD or if the patient has asthma, here we are also concerning if the patient smoke or not, because obviously this is going to increase morbidity and mortality. Then neuro, cardiovascular, pulmonary, gastro. So if the patient has gastric ulcer or if the patient has a history of GI bleeding. Also if the patient take medications for ulcers or GI bleeding. Urinary, this is if the patient has any urinary tract infection or if the patient has a permanent catheter or has had issues with folate placement. And also if the patient has an infection, we need to know if the patient is currently taking antibiotics. Heme. So if the patient has any bleeding disorder, here also we include if the patient is taking any anticoagulant medication or antiplatelet. Or if the patient has history of anemia and if it is currently taking iron, endocrine, if the patient has diabetes mellitus or any other endocrine abnormalities like thyroid abnormalities, and if the patient has currently any infection or currently was treated for an infection, and if this is yes, so which antibiotic, and any other antibiotic, any other medication the patient is taking, if the patient has any allergies. This is any allergies or reaction to medication, because, for example, after the patient, after cardiac surgery, when we are going to decannulate the artery and the vein, we need to give protamine, and the patient can have a reaction with protamine, which is increased in patient with diabetes mellitus. So any medication, any reaction to any medication, any allergies, also protamine is derived from fish, so any fish allergy could contraindicate the use of protamine. And any other allergies. Social, if the patient smokes, also if the patient consumes alcohol. Here we also need to know if the patient has cirrhosis or any abnormality with the liver, and if the patient has delirium tremens, because this also is going to affect the postoperative management. So a complete history of the patient, more focused to these specific points I wrote, but is basically a complete history of the patient, also a complete physical examination of the patient. So in one physical examination we have neuro, so any neurological deficits. So neurological examination, head and neck examination, and this is, for example, if the patient is going to have a valve replacement surgery, so we need to investigate for dental caries. Then cardiovascular examination, so heart, any murmur we can hear in the chest, the rate of the patient, if we have rhythmic rate or an irregular rate, if the patient has bradycardia or tachycardia. Lungs, so this is basically auscultation of the lung, and this can give us a clue if the patient has chronic heart failure or heart failure. So also we investigate for heart failure. Neuro, cardio, lung, gastro. This is straightforward, just abdominal examination, just to make sure we are not missing something. Urinary and infection. This is basically we are going to examine the skin to see if or to evaluate any sign of infection. And then labs we frequently ask before surgery. We need a complete blood count. We need to know if the patient has anemia. If the patient has severe anemia, we will need to correct the anemia before the surgery. So we need to evaluate red blood cell, we need to evaluate white blood cell. This is to see if the patient has or could have an infection. So leukocyte count, also platelet count, because of the risk of bleeding, because all the patients that will undergo cardiac surgery are going to be on heparin. So risk of bleeding, we need to evaluate the platelets. Also, heparin-induced thrombocytopenia is a complication of heparin. So we want to know the baseline platelets of the patient. We need to cross-match the blood of the patients. All patients need to have 2 packs of red blood cell, just in case the patient bleeds. If it's a patient that is going to have a reoperation, then we will prepare for 4 packs of red blood cell and fresh frozen plasma. But generally we just cross match for 2 pack red blood cell. So we need to know the patient type of blood and basic metabolic panel, which is going to include glucose, electrolytes, basically sodium, potassium, chloride, bicarbonate, blood, urea, nitrogen. We also ask for a urine analysis to evaluate for urinary tract infection. We could also ask for TSH. This is in case of the patient has atrial fibrillation, which will need amiodarone to control the rate, or if we suspect the patient is going to be on amiodarone, so we need to evaluate TSH, because either hypo or hyperthyroidism is a complication of amiodarone. And image study. Also, if the patient has diabetes, we also ask for hemoglobin, glycosylated hemoglobin. And imaging studies, we always ask for a chest X-ray. This is posterior anterior chest X-ray and a lateral view. We always ask for this, and always an electrocardiogram. This is to evaluate the normal rhythm of the patient, because if the normal rhythm of the patient is atrial fibrillation, after the cardiac surgery, if the patient has atrial fibrillation, we will know that is normal for this patient. But if the patient normal rhythm is sinus rhythm, and after the cardiac surgery the patient is in atrial fibrillation, we could try to change the rhythm. So we need to know what is the normal rhythm for the patient. And we can also evaluate many things with the EKG, for example, ischemia. Most of the time we also ask for an echocardiogram. This is to evaluate wall motion of the heart, to evaluate valves, any intracardiac shunt we can have, pericardial thickness and presence of pericardial fluid, and aortic calcification. This is because excess calcification of the aorta can affect the site of arterial cannulation. So basically, preparative assessment of a patient undergoing cardiac surgery is a complete physical examination, with most attention to any neurological history, either stroke or transient ischemic attack, any cardiovascular history, myocardial infarction, heart failure, COPD, asthma, any allergies, any bleeding history, ulcers or bleeding disorders, and if the patient smokes, obviously. Complete physical examination with most focus to the heart, to any sign of infection in the skin, lung, and neurological examination, just to have a baseline comparison and also evaluate for risk of surgery. And laboratory studies, a complete blood cell count, cross-match 2 packs of red blood cell for most surgeries, base metabolic panel, which would be glucose, glycosylated glucose, electrolytes, blood urea nitrogen. We also ask for urinalysis, TCH in case of amiodarone anticipation use, and imaging studies would be a posterior, anterior, and lateral view of a chest X-ray, an EKG, and most of the time an echocardiogram to evaluate for wall motion, valves, intracranial shunts, the pericardium, and aortic calcification.